My mother worked for a primary care doctor as a medical assistant for years. And so when I was a young boy and she had to care for me, she worked on evenings, and I spent a lot of time in the doctor's office. And so got used to that sort of environment and realized I liked that sort of field and decided that I'd go into medicine. I was a college football player, and unfortunately, or fortunately I guess, I spent more time with the medical staff, with the orthopedic surgeons and with the trainers and with the physical therapists than I actually did on the field due to injuries, and realized that I could use my interest in medicine and my interest in sports, and felt that I could relate to people with sports injuries, and it seemed to be just a natural connection. Most of my treatments are around the knee and shoulder. I take care of a fair amount of elbow problems and a little bit of ankle trauma, but predominantly I take care of problems with the knee and shoulder. So it may be if somebody tears a tendon, their rotator cuff, or tears a ligament in their knee, their ACL, or some of the other structures around their knee, perhaps injure their cartilage or other ligaments or soft tissues. Most of the time that's what I'm treating. But I do try to treat all the problems that we'll see in active people. Most of the techniques that we use in sports medicine and a lot of the things that I learned in my fellowship and that we learned from sort of having a sports medicine approach is that we try to do things minimally invasive with the least amount of tissue damage, and then try to get people back as quickly and as safely as possible. And that's sort of the expertise. That's a little nuance, and it's not so cut and dry for each patient. People are different ages and different activity levels and different capabilities. And so part of the skill that a sports medicine doctor myself tries to bring to the table is just that being able to figure out exactly how to get those people back to where they want to be, the least invasive way, and as quickly as safely possible. I think it's real important to listen to what the patient's talking about and try to figure out exactly what they want. You can't set out on a trip if you don't know your destination. You're not going to get there. So it's real important. If I want the patient and I to get to the right place, we got to know where that place is. And it takes a little time to figure that out sometimes. I take a lot of effort in trying to not only have my patients understand what the plan is. I communicate with them through email, I communicate with them through the phone, we communicate through handouts and literature that I've provided, and similarly on my website, much of this literature is available for my patients so that they understand what's needed of them. And particularly post-operatively, I will call my patients the night of surgery, and then the week after surgery when they come for a visit, I like to review all the information, the do's and don'ts. It's very critical that they know exactly what they need to do. My greatest success is when, and this is going to sound weird I guess, but it's when a patient actually forgets about me. When my patient forgets they even had surgery. So it's not uncommon for a patient to come back to me to see me for a different problem, and let's say they come in for their shoulder and I'll ask them, well, how's your knee? And they don't even remember that I operated on their knee. And they can't even find the scars, or they're so back to their life that they don't even know they had surgery. And that to me is the sort of most special thing that I can think of and the most rewarding. Throughout the years I've had patients like that, and I've had patients who've had really tough times, and maybe we've had a little rockier road in the past as we've recovered from their surgery, and to see them get better, get on with their lives, and then come back to me at a later date and not even remembering how difficult things had been at times is probably the most rewarding thing that I see in my practice.